Globally, the pandemic is associated with increasing daily infections, deaths, social disruption, economic loss, anxiety and uncertainty about the future, which results in emotional strain and fear about the contagion, health, safety, and livelihoods of the population. Stigma associated with the disease is also a cause of psychological distress. Healthcare workers and frontline workers are at high risk of stress and trauma-related disorders. Further, the containment measures such as stay-at-home, physical distancing, and restricted movement directives adversely affect social and mental well-being of healthy individuals by inhibiting social interaction, social connectedness, and engagement in healthy lifestyles. People with severe mental illness, intellectual and cognitive disabilities are often targets of abuse, ridicule, and neglect in their communities. These individuals will most likely lack care or support to adhere to the containment measures and may even be homeless to begin with. All these challenges predispose this socially vulnerable population to a high risk of contracting COVID-19 and therefore their continued well-being and quality of life. Supporting mental health remains one of the government's highest priorities. The Ministry of Health and partners are continuing to take action to help Kenyans whose mental health and well-being is being affected by the pandemic by providing mental health and psychosocial support strategies and measures which are critical in the short and long-term response to COVID-19 pandemic. These interventions and services that the government is providing include prioritizing mental health and psychosocial support systems, mental health and psychosocial support social teams are providing mental health and psychological services to the general public, to those who are quarantined and hospitalized, healthcare workers, and high-risk vulnerable groups. Government is also providing 24-hour access to tele-counseling services that provide psychological care via hotline numbers 1199 and 719. And implementation of the Presidential Directive on Mental Health and transformation of the Mathare Mental Hospital into a semi-autonomous government agency or a parastatal to provide referred specialized care, training, and research in mental health. We have talked about mental health today because that is one of the areas and mandates of the Ministry of Health.